hope you're doing well this morning. Our mission is free healthcare. I'm Samiksha,
And I'm Risha.
and today our mission is to implement free healthcare.
I have been to 2 of the 7 continents, North America and Asia.
I, on the other hand, have been to 4 of the 7 continents. I've been to Europe, Australia, Asia, and of course North America, where we are now.
Free healthcare typically refers to a healthcare system where medical services are provided to the patient at no direct cost. This is provided to all citizens in a country. This includes services like doctor visits, hospital care, preventive care, medications, and even dental and vision care. However, free healthcare doesn't mean no cost involved. You still need to pay your taxes and government funding.
You see, in a civilized society, access to free healthcare should not be determined by one's financial status or wealth. Illness does not discriminate based on those things, so why should our healthcare system?
We chose this topic because we believe that healthcare is a basic human need. You know that healthcare is expensive in this country and not everyone can afford it. This problem is everywhere in places like India even. Many developed nations around the world have successfully implemented universal healthcare systems. Countries like Canada and the UK have demonstrated how amazing it is to provide free healthcare to all citizens.
Healthcare costs have been steadily rising in many countries, outpacing inflation and wage growth. Factors contributing to this rise include technological advancements, an aging population, and an increased prevalence of chronic diseases. Let me give you some examples. A knee replacement surgery in the US could cost an upwards of $50,000, while it is 10 times cheaper in India. Chemotherapy treatment in the US could cost an upwards of $40,000, while it is 50 times cheaper at $8,000 in India.
Programs like vaccination and public health are more effective when they reach the entire population. This way, our main goal is to provide good medical care, not making more money. A healthy workforce attracts businesses and encourages new ideas. Investing in free health care signals to human capital development and positions a country for long-term economic growth.
Our solution to this problem is to provide free healthcare as a non-profit organization. Contrary to common misconceptions, implementing free healthcare can actually be beneficial in the long run.
Did you know that 28 million people don't have health insurance? A yearly health insurance in the US costs about $8,000. So for this donation, we need about $236 billion to make sure that everyone has the healthcare that they need. We're going to spend this money by gathering all of it and giving it to the people in need of healthcare. By doing this, we can make sure that people have good healthcare, one of the most important things in the world. We will donate to many hospitals and shelters with people who don't have health insurance or cannot afford good health care. We'll use the money responsibly and divide it between many shelters. We will keep some money in case more people without health insurance come up so we can fund them as well. We need your help and investment to make sure that everyone has good health care.
You should trust us because we are trustworthy people and won't try to keep the money to ourselves, but we will manage it responsibly. The money will all be gathered and put into a safe place where it will remain until we use it. We are also Girl Scout cadets who just graduated, so we have experience dealing with community projects and money.
If we do this, others and we will not need to pay any money for good health care, and you could do many other things with the money that you save. If you save the cost of healthcare for many years, you could even buy a house. Everyone will be able to access the medicine and medical care that they need.
Our idea is better than others because our idea is the only one that takes your money but impacts you. Other ideas like homelessness and sanitation take your money but impact others, not you directly. In conclusion, the case for free healthcare is not just a case of economics or politics. It is a basic human right. By implementing free healthcare into our society, we uphold the values of compassion, equality, and solidarity. Let us work together to build a society that upholds the values of all regardless of wealth or privilege.
Thank you for listening to our presentation.